Yeah, great. Now, one area which probably could benefit greatly from this type of approach is the non-alcoholic fatty liver disease that
Yeah.
you've been working on for quite a time, and recently have done some press around. Could you speak a little about this condition and why this could or is already becoming a very serious health crisis here in Canada?
So, it's interesting because this is, also goes on with my history as a liver specialist because, of course, fatty liver disease has been around for a long time. So non-alcoholic fatty liver disease means, so alcohol can cause fatty liver disease, but people that don't drink at all have been known for a long time to get fatty liver disease too. It's usually associated with being overweight, especially fat around kind of the middle, and diabetes. Those are the main, and people with high cholesterol. Those are the sort of the things, and metabolic syndrome is if you throw high blood pressure in there, and so we knew it was an entity, but we always felt it was benign. Didn't do anything. It was just like fat anywhere else, just kind of sat there. It wasn't a worry. And I remember telling patients, don't worry, this is nothing, don't worry. Partly because what we know now, well, what we know is that we know about 25 to 30% of Canadian adults have fatty liver disease. And it's and it's a growing epidemic amongst children as children obesity gets to be more of an issue. And so it is extremely common, like extremely common.
Okay.
Yeah, the problem and the issue is though, only 2 to 3% of the Canadian population has what's called non-alcoholic steatohepatitis, or NASH, is the fancy. So one's called NAFL, non-alcoholic fatty liver disease, which is kind of the whole spectrum of everything. And NASH is actually when the immune system, for some reason, decides that the fat should not be there in the liver, and the fat causes a little bit of inflammation. The immune system goes in to clean it up, and so it actually destroys liver cells as part of that. And if you destroy enough liver cells, then you start to heal. The liver tries to heal itself by scarring. You get enough scarring in the liver, then that's what cirrhosis is, just lots of scarring in the liver. And so there is a subgroup of people that have non-alcoholic fatty liver disease, or NAFL, that actually end up getting cirrhosis. But it's
Wow.
a relatively small number. And so you have this giant sort of numbers of prevalence of people with fatty liver disease in Canada. How could you possibly ever pick out the ones that are going to get into trouble? And so as humans so often do, we just said, well, I think it's a benign disease, right? And that was it, right? But now we recognize that's not true in those small numbers, and so we need to figure out ways to try to pull those people out of the group of people that it's not a liver problem they have. They might have fat in the liver, but it's not a liver problem. It's a problem with their broad metabolism, and there are other people, not a liver specialist, should be looking after them, and the fatty liver disease, and those people will get better. Diet, exercise, all the things that we all know about, and making sure that their cholesterol is controlled and their blood pressure is controlled, so they don't die of strokes and heart attacks. But the people with liver condition, there are different ideas on how to try to pull them out, and one of them is you can use blood tests, and those blood tests can actually tell you if people have, or suggest if people are more likely to have more scarring. But what we decided to do in Calgary is we partnered with the primary care physicians, and we partnered with the largest radiology provider in Calgary, who agreed to do all of the prerequisites to make sure that they were doing quality tests. And so we actually took what was recommended to do these kind of testing in Europe, and they followed that. And so we were comfortable that they could do reproducible, high quality testing. And what it is an ultrasound based technique, which is in the community. So an ultrasound, you go for an ultrasound, but there's actually, it puts a sound pulse wave through the liver, and it gives you a reading for liver stiffness. And in specialist clinics, they have something called a fiber scan, which is the same technology, but this is actually in the community. And then we made a pathway around that called the NAFLD pathway. And we then said to the family physicians, we're going to empower you to order this. If you have a patient with fatty liver disease or suspected fatty liver disease, then this is a test that you order. And if you order this test and if it's below a certain cutoff, and we pick the cutoff based on the literature, then they don't need to see us. And here's how you should manage them for their non-liver issue. If it's above that cutoff, then they probably should see a liver specialist.
Okay.
And so it's been very, very effective at kind of weeding out the people that don't need to see us, which is actually turns out to be over 90% don't need to come see a specialist. So our referrals for fatty liver disease used to be our number one referral, and it still is a very high referral rate, but it's dropped off hugely because what would happen is most of these people would come, we would do a fiber scan in our clinic, and we'd say, you know what, you don't really have any liver disease. You have fat in your liver, but you don't have disease, you don't have scarring, and so you have a low risk of progressing. So let's work on your metabolic things, but that's really more in the family physician's arena, not in the liver specialist arena. So we think we more appropriately placed people where they're going to get the best care, and avoided them driving 3 hours to go see a specialist to say, look, your liver's fine, as opposed to having it done and then not driving 3 hours and having their family doctor work on the things that they need to work on to make them live longer that has nothing to do with their liver.